Missing 1 night of sleep makes you tired. Missing 2 nights makes you foggy. But what happens when sleep loss is not occasional, when it becomes normal? Chronic sleep deprivation does not always feel dramatic. It does not always announce itself loudly. It accumulates. Quietly, gradually, biologically. Chronic sleep deprivation is typically defined as consistently getting less sleep than your body requires over weeks, months, or years. For many adults, this means regularly sleeping under 6 hours per night. The body adapts, but adaptation is not optimization. Over time, chronic sleep restriction reshapes multiple systems. The first system affected is cognitive function. The prefrontal cortex, responsible for decision-making, impulse control, and attention, is highly sensitive to sleep loss. Under chronic restriction, attention span narrows, working memory capacity decreases, reaction time slows, but perhaps more importantly, awareness of impairment declines. Sleep deprived individuals often underestimate their cognitive deficits. They feel normal, even when objective testing shows decline. This creates risk. Chronic sleep deprivation is associated with increased error, RATES, in higher responsibility professions. Medical errors, industrial accidents. Driving collisions. The brain cannot maintain peak vigilance without restoration. Memory consolidation also weakens. Without sufficient deep sleep, factual memory becomes unstable. Without sufficient REM, emotional integration becomes incomplete. Over months, this can manifest as reduced learning efficiency. Tasks take longer, retention declines, creativity narrows, but the effects extend beyond cognition. Chronic sleep restriction alters metabolic regulation. Insulin sensitivity decreases, glucose tolerance weakens. The body becomes less efficient at processing sugar. Even a few nights of short sleep can produce measurable changes in insulin response over longer periods. Risk for metabolic disorders increases. Appetite hormones also shift. Ghrelin, the hormone that signals hunger, increases. Leptin, the hormone that signals fullness, decreases. This combination promotes increased calorie intake. Especially cravings for high carbohydrate, high-fat foods. Chronic sleep loss subtly influences weight regulation. The immune system is also affected. Sleep supports immune memory. It strengthens antibody production. When sleep is consistently shortened, immune resilience declines. Individuals may become more susceptible to infections. Inflammatory markers in the blood increase. Low-grade inflammation is associated with multiple chronic diseases. Cardiovascular health is influenced as well. Blood pressure regulation depends partly on nighttime dipping. During healthy sleep, blood pressure naturally decreases. Chronic short sleep reduces this dipping effect. Over time, sustained higher nighttime blood pressure increases cardiovascular strain. Stress systems also become dysregulated. Cortisol patterns flatten. Evening cortisol may remain elevated. Morning cortisol may become blunted. This disrupts energy rhythm and mood stability. Chronic sleep deprivation is linked with increased risk of anxiety and depressive symptoms, not because sleep causes mood disorders directly, but because emotional regulation requires REM processing and prefrontal control. Without adequate sleep, emotional reactivity increases, impulse control decreases, negative bias strengthens, social functioning can change. Sleep-deprived individuals may interpret neutral facial expressions as more negative. Empathy may decrease. Conflict sensitivity increases. Relationships are influenced by sleep more than most people realize. There is also evidence linking chronic sleep restriction to long-term brain health. During deep sleep, the lymphatic system clears metabolic waste. Reduced slow-wave sleep decreases clearance efficiency. While research is ongoing, some studies suggest that long-term sleep deprivation may contribute to accumulation of certain proteins associated with neurodegenerative processes. The brain relies on nightly cleaning. When cleaning is consistently shortened, accumulation risk may increase. Importantly, chronic sleep deprivation does not always look extreme. It can look like staying up 1 hour later every night, waking early for work, scrolling before bed, shortening sleep slightly, repeatedly. 1 hour lost nightly equals 7 hours per week, nearly 1 full night of sleep, over months. The deficit compounds. The body tries to compensate. Deep sleep intensity may increase, microsleeps may appear, but compensation has limits. Performance plateaus below potential. Mood becomes less stable, health risk gradually rises. There is also a cultural component. Many societies normalize sleep restriction. Productivity is rewarded. Late nights are praised. Sleep becomes negotiable. But biology is not cultural. The brain does not adjust its need for restoration based on social expectation. It maintains requirement. Chronic deprivation shifts baseline. Fatigue becomes familiar. But familiar does not mean healthy. Recovery is possible. Consistent restoration improves insulin sensitivity, stabilizes cortisol rhythm, improves attention, strengthens immune response, but recovery requires time. One long weekend of sleep does not erase years of restriction. The body recalibrates gradually. Chronic sleep deprivation is not a sudden collapse. It is a slow erosion of clarity, of stability, of resilience. Sleep is not optional maintenance. It is systemic regulation. Every night, the brain and body expect restoration. When that restoration is repeatedly shortened, systems strain. When it is restored, systems stabilize. The difference is cumulative. Over days, over years, sleep shapes long-term health more than momentary productivity ever could. And the most powerful change is often the simplest, consistent, sufficient sleep. Not dramatic, not glamorous, but biologically foundational. There is another dimension to chronic sleep deprivation that involves emotional calibration over time. When sleep is repeatedly shortened, the brain's emotional threshold lowers. Small stressors feel larger. Frustrations escalate more quickly. The amygdala becomes more reactive, while prefrontal regulatory control weakens. Over weeks and months, this imbalance can subtly reshape personality expression. Patience decreases. Irritability becomes more common. Motivation fluctuates more dramatically. This shift is often attributed to life stress. But sleep is frequently an underlying factor. Decision-making also changes gradually under chronic restriction. Risk assessment becomes less accurate. The brain favors short-term rewards over long-term planning. Impulse control weakens. This pattern is measurable in laboratory tasks, but also visible in daily life. Financial decisions, dietary choices, and social responses can all be influenced. Hormonal systems adapt as well. Growth hormone release declines when deep sleep is consistently reduced. This affects tissue repair and physical recovery. Muscle soreness may persist longer. Exercise performance may plateau. The body's resilience to strain decreases subtly. There is also evidence that chronic sleep restriction affects pain perception. Individuals who sleep less consistently report lower pain thresholds. The nervous system becomes more sensitive. Discomfort intensifies more easily. This creates another, reinforcing loop. Discomfort disrupts sleep, and poor sleep increases discomfort. Cognitive aging may also be influenced by long-term sleep patterns. Research suggests that individuals with stable, sufficient sleep show stronger preservation of attention and memory into later decades of life. While many factors shape aging, sleep appears to be one protective element. Perhaps the most concerning aspect of chronic sleep deprivation is normalization. When fatigue becomes constant, it stops feeling abnormal. People adjust expectations downward. Lower energy feels typical. Reduced clarity feels acceptable. But the body does not redefine optimal function. It adapts temporarily while strain accumulates. Recovery begins with awareness. Extending sleep gradually, even by 30 to 60 minutes per night, can produce measurable improvements in mood, metabolic regulation, and attention over weeks. Sleep is cumulative. So is deprivation. And over time, the direction you choose, restoration or restriction, shapes not only how you feel tomorrow, but how your brain and body function years from now. There is also an impact on motivation and reward processing. Chronic sleep deprivation alters how the brain responds to reward. Dopamine pathways, which regulate motivation and pleasure, become dysregulated. In some cases, reward sensitivity increases, leading to stronger cravings for stimulation, sugar, novelty, or risk. In other cases, motivation flattens. Tasks feel harder to initiate. Effort feels heavier. This instability can influence work performance, eating behavior, and even addictive tendencies. When sleep is restricted, the brain seeks faster sources of reward to compensate for reduced energy. Attention networks also fragment over time. Instead of sustained focus, the brain shifts more frequently between tasks. Microsleeps, brief lapses in attention lasting seconds, may occur without awareness. These lapses increase error probability, especially in repetitive or detail-heavy tasks. Chronic restriction also alters time perception. Sleep-deprived individuals often misjudge how long tasks take. They may overestimate productivity or underestimate fatigue. This distortion reinforces the cycle, believing less sleep is manageable when performance is objectively reduced. Another long-term effect involves inflammation. Repeated short sleep increases pro-inflammatory cytokines. Low-grade chronic inflammation is associated with cardiovascular strain, metabolic imbalance, and mood instability. Sleep acts as a nightly anti-inflammatory regulator. Without it, inflammatory signals persist,